What is Health City exactly?
So what's happening is, and Bryce, you and I have talked about this before, there are some huge transformations happening in other sectors around the world.
Mm-hmm.
So we've seen the changes that are happening in media, for example. Very few people use cable anymore. We stream everything, right? Transportation is a great example with Lyft and Uber. Banking, another great example. I can text you money where I couldn't do that a couple of years ago. Well, those changes, interestingly enough, are already happening in health around the world.
Mm-hmm.
They're not happening in Canada.
Mm-hmm.
And that is sort of where I get on my soapbox a little bit is there's no reason why it can't happen in Canada. We have a lot of the intellectual capacity. We have dedicated clinicians in the field. We have a wonderful health system. We should be able to make this happen in Canada as well. And so that's where I've switched now from sort of the interest on the science side of health and really more health as a system. How can we transform healthcare? And that's what Health City is all about, is how do we transform healthcare to the next generation where we can provide health to all the citizens in Canada in an affordable and effective way. And one of those key initiatives that's going to drive that is innovation. It's not the only one. We're going to need some policy support. We're going to need some cultural change. There's a few other things that we're going to need to make that work. But innovation is a key driver for that. And the ability to adopt that innovation is what is going to drive us forward. So that's where Health City is really focusing, is how do we transform the healthcare industry. Now, on the back end of that, where we see a real opportunity is the innovations that are going to transform healthcare, they're being developed here. And Bryce, you highlighted a lot of these companies on your show, both on Alberta Impact and the Future of Health, on the wonderful innovations that are happening right here in our province. So we have the ability to do that here. Let's do it. And so I see a double win here. We can not only transform healthcare, which is going to provide better health for us as citizens, but also is going to be an economic driver for us and be part of our economic diversification strategy for our city, our province, and our country.